Hey guys, welcome back to another epic episode of Navigating Through Medical School podcast, your gateway to the captivating world of medicine and the journey of healthcare professionals. Whether you are a seasoned listener or just tuning in for the first time, this is your getaway to fascinating insights into the medical universe and journey of healthcare pros. This podcast will be your ultimate secret weapon, serving up inspiration and wisdoms to help you ride the ups and downs throughout medical education. And don't forget to hit us up on our Instagram page at AMSA UPNM to follow the latest updates. I'm Yoshini Sivaram, your chill host for today's episode. And guess what? We have an incredible guest lineup today. And he's a real pro in family medicine who's ready to share his knowledge bombs and experience with us. So let us not waste time and welcome our guest. It's none other than Dr. Leeynesh Sooriyapiragasam. Hello, doctor. How are you?
Hi, Yoshini. I'm good. Thank you so much for inviting me today. How are you?
I'm fine, doctor.
By the way, thank you for the impressive introduction. I am not a pro in family medicine, but hopefully I'll get there someday. Yeah.
All right, doctor. So before we dive into our chat, could you please tell us about yourself to the audience and your evolution in medicine? Like, how did you come up from hitting up the book and where you stand today? And most importantly, what sparked your passion, your interest in this field in the first place, doctor?
All right. Thank you for this question. Feels like being in medical interview before entering school. Well, to be honest, I grew up just a small family. My father is a medical assistant. So since young, I follow him to all these clinics and all to see how he works with patient and all. So I think that's where the passion starts. And then subsequently, coming from a middle class Indian family, there's always a pressure of you need to do well in your life, and therefore the only thing that can bring you up in life is always education. So my parents has always both my sister and I, like, we need to fully focus on education. So at that point of time, I was actually between when I was in primary school, I was actually thinking more between as a historian or actually in medical science field.
Oh, wow.
And then so subsequently, then I realized that I have more things to actually like to talk to people. I've been doing volunteer service with Sai Baba Society and things like that, and then also other charity organization. So that's when I felt like, okay, probably medical is my take. So I think basically since when I was in secondary school, I already knew I'm just going to be a medical doctor somehow by hook or crook. So along the way, after PMR, SPM, and then I came to apply to UPNM. But when I was applying to UPNM, I was also applying to UPM and other places actually. So I've had offers from Russia and Indonesia, but decided to stay here because closer to family in a way. Yeah, so that's the reason. And then another thing that sparked my interest in medical was actually within my immediate and family members, we don't really have doctors actually. So the only thing closest was my father as a medical assistant, and even his side also there was no doctor. So I mean, ideally right now, if you look, somehow one family will have one doctor at least right now along the way. So that's why I did embark into medical field lah.
Yeah. Doctor, awesome, doctor. So from a military university UPNM to rocking in a medical career, that is really impressive, doctor. So actually, you chose UPNM, but you still had other choice like Russia, UPM, and other universities. My question is, how did UPNM, the whole military vibe, change your journey towards medicine? How it actually alter your approach to medicine?
Okay, so like what I said just now, my father is a medical assistant, but I didn't say that he was actually a medical assistant in the army actually.
Oh.
So, but he is a civilian actually. He's a civilian medical assistant in the army. So along the way, when I started to see because I come from a middle class family, right? So looking at the tuition fee cost and all, definitely our local government university is much more affordable for me at that point of time. So that is why I chose UPNM. But I would say, okay, initially my thoughts of UPNM was literally like military, like, oh my God, life is going to be so difficult and things like that. Yes, life wasn't as easy as how I wanted to, but it has taught me a lot of discipline. Because we were one of the first few batches in UPNM, I was only the fourth batch actually. So we did come across with a lot of challenges. At that point, they were AMSA UPM, and then but we wanted to bring to AMSA UPNM. It was such a difficult thing. So I'm glad that you guys actually managed to bring it up. And that time we could only have MilliMeds, like Military Medical Student Society, among us. And that too, it became very challenging for us because it wasn't an official registered society at that point of time. And then slowly it became a registered society, you know. So the way UPNM have actually taught us how to overcome a lot of challenging things and then become more disciplined. I think this discipline is one important aspect that you have to carry throughout your life because you're going to build yourself into a professional career. When when a patient sees you looking at how well groomed you are, it might develop a strong personality that they feel confident that you are their patient and you are their doctor. So along the way, I think that plays an important role. So I believe UPNM actually did shape me for who I am today.
Really cool, Doctor. You're actually one of us alumni, so I'm really proud of that. So,
Thank you.
next question is: I was actually casually going through your CV and I was stumbled upon your diploma in clinical hypnotherapy at London College of Clinical Hypnosis, United Kingdom. And you did this diploma while you are in fourth year in UPNM while doing Doctor of Medicine. So, actually, how did you juggle through the medical school and also your diploma journey, Doctor?
Okay. So when I was in third year medical school, because that's the time we started to get exposed into clinicals, right? I started to feel my self motivation was being affected in a way because I feel like I didn't really know what to do. You know that culture shock transition from being a preclinical to clinical, and suddenly you felt like so many things is going into your head, so many things you need to learn, so many things you need to understand. Along the way, I kind of developed some form of anxiety on myself. So if you know our society, mental health is being seen as a taboo. uh, so when I try to get help from a counselor, they just like, oh, it's okay, you can overcome through this and things like that. But that's not something I wanted. I wanted something more. So along the way, I was also active in a society of MMA medical students, and I always look at the magazine. So when I look at the magazine, I came across with this course, Diploma in Clinical Hypnotherapy. So that is when I went for this course. So this course was about 1.5 years, where the course is being done every week, every one weekend in a month at University Malaya, and it's accredited by London College, Kenya. So when I go there, then I started to learn about relaxation techniques, self hypnosis, and things like that. So instead of practicing on other people, I practice on myself first. So I managed to bring down my anxiety and things like that. And along the way, when psychiatry posting came, it became a very, very huge helpful. I started to talk to our students about our patients about this, uh, like how to actually do relaxation techniques, breathing techniques, especially when you're having stress. And hypnotherapy itself, it can help to for treatment like smoking prevention, obesity prevention, and it's coming up in a field like where you can go into hypno anesthesia, where you have wallet surgery for like your hand surgery. If you need a wallet surgery, you can be doing that under hypno anesthesia. And then now you have hypno birthing as well, where actually pregnant mothers they actually take the gas during delivering. Now you can actually try hypnobirthing. So it's a field that is coming up actually, and in fact it's evidence based medicine in a way. But definitely there's a lot of exposure. So as a student, I was juggling both of these because I just wanted to do more. I just wanted to, of course, in UPNM, always want to be the best among the best. And I coming from a civilian medical student background, I think if I want to survive out there, I need something more stronger. So that is why I embarked into this clinical hypnotherapy journey. Yeah.
Okay, Doctor. All right, guys, buckle up because we have a real life superhero with us in this house. You actually did a very good job, Doctor, by juggling both your degree and also diploma. And then also, we did a little survey among our medical students, and they are actually very curious to know about your day to day life as a houseman. So, could you mind sharing with us your experience as a HO and also maybe throw up some hurdles that you have leaped over, Doctor?
Okay, thank you for the question. So I think housemanship is the one most important phase of our lives.
Uh-huh.
I started my housemanship in 2020 in Hospital Putrajaya, where my first posting was PITS, followed by internal medicine, surgery, uh, orthopedics, ONG, and then I went to primary care, clinical setup. So you must get ready on the when you sign the form and all. They just put there your working hours will be 8:30 to 5:30 or 8:30 to 6:30, but it doesn't work that way.
Mm.
Most,
Okay.
most of the time you need to be in the hospital before 6, and
Mm-hmm.
and then you'll finish your work probably about 7 or 8 p.m. So that is a solid 12 to 12 to 14 hours of working. And each department, once you newly enter, you have 2 weeks of tagging. And tagging is the time where, in a way, you want to get familiarize yourself with the department,
Mm-hmm.
and also you want to know how the workflow. So usually for tagging, they will say your work is on from 8 a.m. to 10 p.m. But it doesn't work that way. You'll have to be there by 6 a.m. to 11 p.m. So
Oh.
that's about 17 hours of working per day for 6 days in a week with one off day.
Yes.
Okay,
I can see you, doctor.
it's okay. You guys will someday will be there also. Uh,
Mhm.
Honestly, I would say our housemanship training is quite intense, but it's not impossible. It is doable actually. It's just that you must have a proper mindset that you are actually entering housemanship for learning. And once I'm out from this department, I must know all the basics which I can apply into my future medical life. So that if you go along that way and make sure, like how our lecturers in UPNM always say, you need to be a safe doctor, you need to be a safe doctor. Maintain that momentum, just be a safe doctor. Anything you're not sure, you just ask your seniors. Of course, there are some seniors who will scold you, but if you take the scolding as a part as a learning, I think you can change the way how you think, and along the way you can survive. Other than that, during housemanship, you don't think your life will be chill. No, you will have exam every 2 to 3 weeks, and at the end of the tagging, also they will ask you to do an end of tagging examination. Then only you can actually on call. Without finishing your end of tagging examination, they won't ask you to on call most of the time. So if you want to go back for 1 month, 6 a.m. to 10 p.m. and as well, you just finish your end of tagging examination earlier lah, within 2 weeks, so you can go back earlier on that days. Uh, Other than that, sometimes you have like objective questions. It's like a medical school actually. Every 4 months,
Oh.
you have an
Okay.
assessment. You pass your assessment, then you can go to the next posting, and
Mm.
and you must be good in your skills. Follow your logbook, complete your logbook, and things like that. Now, the issue that right now that we are facing is actually the lack of housemen entering into hospitals. So,
Mm-hmm.
so that is what the current issue is going on. So that is why housemen becoming overloaded with the work. Like nowadays, because I'm here in Johor, right? So sometimes we can see in HSA two housemen in one whole ward. So that is like 1 to 30 patients kind of ratio, one doctor to 30 patient ratio. So they're over because they had to do so many things. They become like a clerk. They take the blood and then they just do whatever is going on. So because of this, some housemen they feel they don't learn anything
Oh. Okay.
because you're doing like a clerk job. I'm taking blood. I'm going to send the blood. Whatever my MO asks to do, I do. But I think along the way, if you think, okay, it's all right, this is my patient, I'm going to treat this as my patient, as my family member, that kind of thing. Along the way, something you will actually learn. So to survive housemanship, the most important thing is perception on how you take things actually. If you want to follow, like, okay, I'm going to take this as my learning curve for me to improve myself, I think it's easily survivable and doable.
Mm-hmm.
Mm.
Okay, doctor. Thank you. And another thing that caught my eye on your CV was your postgrad on leadership in medicine at Harvard Medical School. So basically, Harvard Medical School is like every medical student's dream, right, doctor? So
Yeah.
how was the experience studying at there? And do you really went to Harvard, or is it like your diploma,
Okay.
doctor?
All right. So, when I was in secondary school, when my teacher asked one day, like, where do you want to do your medicine? I just blatantly answered Harvard Medical School. But of course, it's not easy to go there. And
Yeah,
then,
yeah.
yeah, so after graduation, I applied this program called Leadership in Medicine Southeast Asia program. So I actually been applying to that program since graduation 2019, 2020, but I only got admitted. Got an admission from that in 2021. Yeah, 2021. So actually, this program is actually virtual, and the last workshop is supposed to be held in physically in Harvard itself in Boston. So it's a leadership course where they actually teach you about management, leadership in healthcare, funding, financial. It is more like a pre-MBA kind of course. So I believe as a doctor, your work is not only to treat patient. At the end of the day, you need to know how to manage certain stuff. You will have a lot of portfolio to hold. You will have auditing to do. So this kind of exposure, like being exposed to certain like an MBA course or leadership course, will give you a better skills for that, lah.
Mhm.
And so I did that during my second year of housemanship.
Okay.
Yeah. So yeah, it was good. It was interesting, and most of my colleagues were one of my colleagues were the pengarah of hospital, University Malaya Medical Center, and then pengarah kesihatan dental from KKM. So we get to know like different kind of background. And my group mate, one of them is the medical manager for Sunway Medical Group. So we learned on their perception how they manage things and things like that. It was quite a good exposure, lah. But of course, it's not free. It's quite expensive
So,
because
yeah.
yeah.
So it was self-funded or any scholarship, doctor?
Okay, so I get a partial scholarship from Sunway
Okay.
University. So the entire cost is actually about 70,000. So I
Mhm.
managed to secure about 30% scholarship. So the balance is self-funded lah. While I was working as a houseman, I just paid it off lah along the way.
Okay, doctor. So, do you went for the last workshop at Harvard?
Okay, so again, our COVID was raising at that point of time, so I couldn't get my flight to go there, so I didn't go there. But of course, every year we have a gathering, so if I want, I can just go there. But yeah, so far I'm just keeping in touch through WhatsApp group and through emails. Yeah,
Okay, doctor. But actually, that was so sad. You were supposed to go, right? But because
yeah,
of COVID, you can't go.
yeah,
Okay,
true.
doctor. So another question that we got like from our survey was
Mhm.
about the pathway to become specialist doctor.
Okay.
And then you are doing a specialist in family medicine, right, doctor? So
Yes.
spill the beans, doctor. How do you land in your specialist amidst the sea of options? And also, we are dying to know how hustling was your adventure of specialty, doctor.
Okay. So when I entered medical school, the only thing that I thought I will be a forensic pathologist because I was so into CSI, crime scene investigation, that kind of show. But along the way, I realized that I like to treat patients, I like to talk to them, I like to see them as a whole. So my top two specialization at that point of time after graduating was internal medicine or family medicine. But I didn't want to push myself further. I just wanted to explore housemanship first, how it goes. So along the housemanship rotation, I really enjoyed internal medicine. And after I completed internal medicine, then I realized that on call is not my thing because I realized that I get very grumpy if I on call back to back. So I didn't want to do unnecessary things to my patient. So that is why I explored family medicine. So along the way, family medicine, yes, you do manage your patient 8 to 5, but in KK sometimes we also have to do passive call up to 10 p.m. And during that time, influenza and COVID were coming back up, so we had to open our clinic up to 10 p.m. also. So that point of time, I realized that I like to see patient as an outpatient, because as an outpatient, you're actually managing them as a whole thing. You will see an OPD case, which is an outpatient case. You will also see a non-communicable diseases. So that was really challenging. So when I was in housemanship, I actually attempted in MEDEX, family medicine, medical medical specialization pre-entrance examination, and I got band 4 for my family medicine. So technically, if I'm still in KKM, I can actually apply for the Masters in Medicine for Family Medicine program. But since I did my postgraduate diploma in diabetes in primary care and my Harvard and my diploma in clinical hypnosis, I wanted to give an attempt to try to apply to private universities. So when I applied to private universities, I managed to land on a job which is called clinical lecturer in family medicine. So the only thing that they wanted is to make sure I continue my family medicine specialization. So once you are already in private side, to enter into masters in family medicine in government side will be a bit difficult. It is not impossible, but it is quite difficult. So I took the parallel pathway option, which is through the Academy of Family Medicine Malaysia pathway, where you'll be doing 2 years of graduate certificate in family medicine and another 2 years graduation, 2 years program in advanced training in family medicine. And at the end of the fourth year, then you'll be sitting for an exam between Fellowship of American Family, Fellowship of Association Family Physicians of Malaysia, and Fellowship of Royal Australasian College of general practitioners in Australia. So it's a double recognition between Malaysia and Australia. That is one parallel pathway. But let's say you are in government, you are still willing to do family medicine specialization. Of course, apart from the government Malaysian, the Masters in Family Medicine, you can also apply to MIN FM program. That is called Malaysian Island Training in Family Medicine, which is offered by Penang Medical College. So in Malaysia, at this point of time, there's only 3 specialization pathway for family medicine. Previously, we had one we call MRCGP, the membership of Royal College of General Practitioners from UK. But that for that, you need to go to UK. You need to join their training. Once you complete their training, only then you'll be recognized here. So you cannot do it from here, the MRCGP program.
Okay,
Yeah.
so, okay, Doctor, now let's talk about your research project on patient blood management protocol. Actually, this is my personal question. How did you find such a unique research idea, Doctor?
All right. Okay. So to be honest, this is not my entire idea by myself. It's together with my supervisor, Dr. Kevin and Prof. Ina from University Malaya Medical Center. So my year 4, I did electives in University Malaya and also Vietnam. So I did 2 electives actually in my year 4. So the 1 month in anesthesia, my supervisor along the way, because we had attachment in anesthesia, she was really very helpful. She was really very nice. Brought me to ICU. She allowed us to intubate patient with her supervision and things like that. It was really good. But along the way, I noticed that sometimes we need to get ready of patients. We call this GSH, group screen hold, in case we suspect that patient might have extra bleeding. And we always come to you can always see actually on Instagram, if you follow Pusat Darah Negara, they will say from time to time we don't have enough of this group of blood, we don't have that group of blood, come and donate this and so and so. So I was talking to this actually to my supervisor. Then she was telling, okay, look, in UK they have this thing called patient blood management protocol, and we might do a research on this. Would you be interested to be a part of it? So that time she asked me when I was in end of year 4. Then I told like, of course I need to concentrate in my final year exam first. So I told like, Doctor, can I join after my final year exam? She was like, okay, sure. So okay, sure. So the moment I completed my year 5 final exam, I gave her a text again. And then she said, okay, Leeynesh, you can come and join our team. So I was in University Malaya for 11 months before I entered housemanship. So there we did this patient blood management protocol, which we call it as PRO-PDM. So you actually want to reduce blood being transfused during surgery. Actually, this this in a way is actually a life-saving procedure. So, for example, let's say there's a patient going for colorectal cancer surgery, where
Mhm.
you need to do a total colectomy and things like that. So sometimes you need to transfuse blood for this patient. So before that, you need to assess the baseline hemoglobin of this patient. So let's say the baseline hemoglobin of this patient is about 11 to 12. If this
Mhm.
if this patient is going for an op that's going to last about 3 to 4 hours or maybe 2 to 3 hours, definitely there'll be a drop of hemoglobin to 9 to 10. And as you all know, when the blood drop to 8 gram per deciliter, you will need to stand by the blood results. I mean,
Okay.
you need to stand by with bloods lah. So that is why we come up with this protocol, blood management protocol, where we actually give intravenous iron infusion 2 weeks before their surgery in a hope that it will increase their hemoglobin. So usually we aim about 2 to 3 gram per deciliter. So let's imagine your baseline is about 10, and 2 weeks later, when you go for your op, after you get the iron transfusion, you'll get about 12 to 13. So
Mhm.
after operation, probably you'll go back to your baseline before. So in that sense, you can actually reduce blood transfusion in a way lah. So until today,
That's
yeah.
that's super interesting, doctor. So actually, what advice do you give to the newbies who actually want to get into research programs out there?
Okay, so first of all, like I said, we need to know our lecturers. Actually, our lecturers have got a lot of very good background. Our own UPNM lecturers, like Dr. Zubaida for physiology, she's very good in gut metabolism and things like that. And
Mhm.
another thing is actually you can start applying electives. Actually, if you talk to our admin team, as a first year or second year, you can actually go for observership or attachment in hospitals, and you can meet all these clinical specialists, and they will actually have sometimes some sort of research idea, and
Mhm.
you can ask what is their research idea and you can collaborate with them. As simple as you write a case study will also, when you publish that also, you will be indexed in a journal. Or if you want to do something as easy as making a simple questionnaire also, it will be very helpful. I'm sure our public health specialists are usually be very, very helpful. You can actually approach any of them. Of course, I would say to do clinical trials and all those are very, very huge thing. We can start something small, a case study, a questionnaire, a survey kind of feedback. All those will be very, very achievable. So actually, even when you guys, you guys do your case write up, right? Sometimes in year 3, year 4, year 5, if the case is very interesting from clinicals, you can actually discuss with the specialist who is involved in that patient, and actually you can publish that actually. So
Mhm.
the thing that in medical world is actually the more you publish, the more you write, only then your research interests will be developed, and along the way your research questions can be developed. It is not something easy that can be done within 1 or 2 days. It takes practice along the way. Yeah, so whatever you do, just be passionate. So definitely there'll be some ideas will come out along the way.
That's a wonderful insight, doctor. So next is we would love to hear about how do you handle the tough talks between patients and their family members, like when you have to deliver heavy news to the patient. How do you handle that, and what is your most unforgettable encounter of patient that you have come across in your career so far?
Okay, all right, this is very good talk. So this topic actually comes under the subheading of called advanced communication in medical practice. So it's definitely not easy when you want to break bad news to family members and all. So of course, you need to know first of all, as an attending practitioner, you must know what the patient has been going through, A to Z. That is one. Another thing, you must know who is the close family member that will be taking care for this patient. Another thing that you want to know, if you started to give some advices or some consultation, which other family members will be impacted. So along the way, sometimes as a junior medical practitioner, you might not have the confidence to break the bad news by your own. What you can do is you can talk to a senior medical officer or a medical officer. Usually, they are willing to accompany you. So and then you must find a proper ambience when you're making a bad news. It's not as easy that just hi, you have a hepatitis B. No, it's not that way. You need to have a proper ambience, get a good support, and you want to ask the patient, would you like anyone else to be with you today? Sometimes patient will require that kind of moral support. Let them sit down, explain to them A to Z. This is so and so. What kind of investigation you have done, and what kind of things that you might have. And if it's treatable, make sure tell to them it is treatable. If it's curable, make sure you tell to the patient also. Give them some kind of light of hope. But if it's really that okay, this doesn't have there's no light at the end of the tunnel, just be as transparent as possible to the patient, because sometimes they deserve to know. Uh,
Mm.
but of course, you must look at what the family members are expecting. There are some family members that sometimes they don't want to break that bad news to the patient. So,
Yes.
so sometimes you need to discuss with the family members what is their expectation as well. So personally, one of the most unforgettable patient encounter that I had was actually there was this patient where she had a stroke.
Mm-hmm.
So she was admitted in ICU because her vagus nerve was not helping in her diaphragmatic, so she need to be intubated along the way. Only then we know that actually this patient is actually a Guillain-Barré syndrome patient, and
Mm-hmm.
her recovery post-stroke is actually very, very poor. And throughout ICU admission, she had like twice of cardiopulmonary arrest, where
Mm-hmm.
along the way she had a very, very bad traumatic brain injury, and we can say that she almost had some sort of brain death lah. So when we were telling this to the family members, her husband were managed to understand, but her mother was not able to understand. She was keep on telling us, "Can you just please revive her? We need her back in life." So that was really heartbreaking to watch actually. So imagine if something like that happened to our family members, it's very, very difficult. But of course, this is our career. There's a good for it. There's also bad for it, and the bad usually comes from emotional blackmail, emotional sadness from the family members and all. And along the way, you will adopt a maturity to overcome this kind of issue. So it should be okay lah, along the way.
Sure thing, doctor. So now let's talk about the real world beyond the hospital walls, doctor. You have done numerous consultancy, community and social surveys as stated in your CV, right, doctor? So could you tell us about what actually sparked that interest in volunteering and lending a hand, doctor? And then also when you go out there, help people and make difference, right, doctor? How did it actually feel? Because I think being a doctor is actually definitely move beyond than textbooks, stethoscopes, and hospital hazards, right, doctor? So how did you do that actually?
Okay, that's very good. I would always say that if you are in medical school, you should do some sort of charity. So the charity is as easy as just doing a basic screening, or as basic as just talking to a patient, talking to a random person also, it helps lah. So for me, as a actually, in fact, before medical student, my parents used to be involved in all those temple religious activity. So where we actually have all kind of charity, and because my father had this military background, usually once a year, in the army camp itself, they used to conduct all this charity. They do a basic screening and things like that, and that's how I developed my interest actually. So along the way, I've participated in Kachara, Teddy Bear, Doctor, and then the United Inside was actually brought up by our senior,
Mm-hmm.
Dr. Yogesh, and all. And then yeah, and then in Johor also we have, and then things like that. So
Mm-hmm.
sometimes I also join the St. John Medical Association, and also MMA volunteer corps lah in Malaysian Medical Association. So when you go see all kind of these patients, of course, sometimes when you read textbook, it's just reading. You don't really actually see what is going on actually. So when you see patient, so there is once that we saw actually a patient with a trill and a murmur of at least grade 3 to grade 4, that even before we could put our stethoscope, we can actually hear that murmur already. So
Mm-hmm.
so that is when we were like, okay, this patient have something is going on. And then her JVP is elevated so huge and all. And we referred this patient, found out that she has been having tricuspid regurgitation in failure. So as simple as actually a medical camp, a part of screening for normal diabetes, pressure, and things like that, you can actually come something that you might read from the textbook, which you can implement in your daily life. And another thing is to actually diagnose someone what they might be having. And another thing that I find a little bit about medical camp is actually along the way, you see, when we do medical camp, we always target that specific group. and then we will go to another place. I believe medical camp should be in future. Once you are already in that specific group, after 1 or 2 years, you should go back to that same group and you screen back and you get back a follow up. What happened to this patient? Has he been treated for his underlying condition? Has he been compliant to his medication? Is it well control of his condition? And are there any complications or not? So all this plays an important role as a medical practitioner lah. I know sometimes as a medical student, because we just go there for a part of, some students might think, okay, this is my extracurricular activity, so I go there. Okay, good that you're going there for a reason, but take it as a part that you are going to learn and you're going to implement that in your daily life. Only then you will see all these signs. And once you enter clinicals, our lecturers, when we were in clinicals, they always say you must do spot diagnosis. When you do spot diagnosis, only then you will learn. So as simple as, when you go to mall, you see suddenly someone is eating and then you feel like the thyroid gland is moving by its own. Then you'll be like, okay, this patient might have some goiter going on. So you learn along the way. Okay, goiter. What kind of goiter could it be? Could it be a thyrotoxicosis goiter, or could it be a hypothyroidism goiter, or could it be an iron deficiency goiter? So that's how you learn. So in charities and all, you can always see some kind of spot diagnosis. So that's why I become more interested. Actually, you learn along the way.
This is truly inspiring, Doctor. So before we wrap up our amazing podcast session, the last question is, what advice would you give to anyone who is keen to start a career in medicine? And also, if you could turn back time and give yourself one piece of advice, what would it be, Doctor?
Okay, so my personal advice is just be passionate. Whatever you do, just do it from your bottom of heart. It's okay if it takes a lot of difficulties or a lot of challenges, but at the end of the day, it will pay you some benefits along the way. That is one. Another thing is, like all the lecturers say, just be a safe doctor. I know sometimes you'll be like, no, I need to be smart. I feel like I'm dumb in this and things like that. But it's okay. It's okay. Really, honestly, it's okay, because along the way, as you see many patients, you will be smart along the way. So just try not to underestimate yourself. Be a safe doctor. Do your basics. Get well of your basics, and definitely you can survive anywhere. And if the journey, if one piece of advice that I would say to myself when I was a medical student, is probably to read more, I guess.
Read more.
Yeah. So textbooks, actually they are very helpful, because, okay, to be honest, I can actually see the gap between the current medical students and also what our seniors used to have. So I think current medical students are more tech savvy. I think you guys have all those e-books through your iPad. You all do questionnaires, everything in iPad, which is very good, but it depends on some individuals. Like for me personally, I cannot be doing everything on iPad. I need that hard copy of book. I need to write notes. I need to highlight. So I am that kind of person. So I would say find your study techniques. Also know what's your study techniques, what kind of study techniques that you are comfortable with, and develop your way along the way. And I'm sure with consistent effort and with good motivation, you can ace in medical career. That shouldn't be a problem.
Thanks, Santan, Dr. Leeynesh, for dropping all these gems of wisdom on us today. Your stories and insights have been an absolute blast to hear. So stay awesome, keep shining bright, and until then, take care, Doctor. And thank you very much for spending time with us during this podcast session, Doctor.
Thank you for inviting me also. You guys also stay awesome, and all the best in your future endeavors.
Okay, thank you, Doctor. So, and to our listeners, if you are hung in there till now, I just want to give you all a virtual hug and say a massive thanks for sticking around and tuning into this amazing session of Navigating Through Medical School podcast. I hope you have enjoyed our chat with Dr. Leeynesh as much as I did. Don't forget to follow up our Instagram page at AMSA UPNM for all the latest updates, and also especially in our IGTV. And until next time, take care everyone, and goodbye.